Welcome everyone to this edition of Liverpool Responds. As we go live, you can interact with us at the end of the sessions where we will tell you about how Liverpool restarted live events. You can use the Q&A function in Zoom. Today, we are going to talk about a remarkable response. Mindful that pandemic resilience in COVID-19 was not just about stopping a virus from spreading or from minimizing the risk of nasty disease if you get infected, but also about minimizing the harms from severe control measures like lockdowns. That includes protecting the social fabric and well-being that we all get from gathering together en masse for sports, music, business, and other events. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity. And the panel we have here today will show you what that really means. I'd like to introduce my panelists. You could pop your cameras on, everyone. Welcome to the panel. First of all, we have Claire. Claire's going to speak first. Claire McColgan's Director of Culture at Liverpool City Council. She's led multi-award winning cultural events and has nurtured Liverpool's visitor economy for over 12 years. She was executive producer of the European Capital of Culture in 2006. And by 10 years later, the major events programme had brought 800,000 visitors a year into Liverpool, £21 million a year into the local economy, and one Visit England's tourism event of the year. For the Events Research Programme, Claire led negotiations with government, enabling this programme really to come to life. Then we'll be hearing from Matt Ashton, Liverpool's Director of Public Health and an honorary professor at the Institute of Population Health here at the university. Matt leads a team of 30 people covering a range of public health activities, including the contact tracing that was vital to the Events Research Programme. Matt also champions innovations in public health intelligence, such as the Cypher system that made it possible for us to have real-time data from COVID testing to reopen our events early in Liverpool. And Matt led the COVID smart mass testing pilot in Liverpool that led to the Events Research Programme. Robin Kemp will speak next. Robin's our leader of creative development for Liverpool's major events programme, finding new ways to collaborate with artists in events that draw local, national, and international audiences and have huge impact for the city's economy and social fabric. He created programmes such as Liverpool Presents Sergeant Pepper at 50 Summers of Love, and for the Events Research Programme, Robin led coordination with the event organisers, overcoming major obstacles to make it possible for Liverpool to reopen the first live music events in the Northern Hemisphere. Then we'll hear from Gary Leeming. Gary's our Director of Liverpool City Region's Civic Data Cooperative based at the university. Formerly Chief Technology Officer at the impactful Connected Health Cities programme and Director of Informatics for Greater Manchester Academic Health Science Network, Gary has over 15 years experience in developing technologies and infrastructure that use data in trustworthy ways for health and care. Together, Gary and Robin made it possible for the Events Research Programme in Liverpool to have near real-time linked data between tests and tickets, which was vital to understanding how COVID safety measures can work around events. Then we'll hear from Michael. Michael Human is a lecturer in psychology at the Institute of Population Health, specialising in emergency responses and decision-making in critical incidents. This work involves engaging with members of the public and local communities, exchanging experiences with first responders, and sharing concerns. Michael used this experience to enable the Events Research Programme to move very quickly in Liverpool, preparing audiences for what to expect and gathering their experiences remarkably thoroughly at very short notice. Then we hear from Rhiannon Corcoran. Rhiannon's Professor of Psychology and Public Mental Health at the Institute of Population Health. She has extensive experience in psychology, social, and environmental determinants of mental distress and well-being, with a particular focus on community well-being. Rhiannon has led the qualitative evaluation of Liverpool's COVID smart mass testing pilot, then the Events Research Programme in Liverpool. And finally, we'll hear from Govan. Govan Burnside is Senior Lecturer in Biostatistics at the Institute of Population Health. He's a highly experienced statistician working with many sources of routinely collected data, clinical and public health data, and all the difficulties that come with routinely collected data. Govan led the analysis of the Events Research Programme data from the Cypherlink data system across Cheshire and Merseyside, which is a region where our audiences lived. He's patiently led a lot of detective work to understand the impacts of COVID and the risk mitigation measures put in place around the events. So without further ado, I'd like to hand on to our first speaker, Claire. Claire.
Thanks, Ian, and hello, everyone. I'm Claire McColgan, I'm Director of Culture at Liverpool. Just a bit of context, really, to this really interesting discussion with a very eclectic group of people who you would never normally have in a room together talking about events. So a bit of background to this. We developed the mass testing pilot, which Matt will talk about probably a little bit later in November. And one of the contexts that we talked to government in around that was a huge part of our economy relies on the cultural, the visitor economy sector. 47% of Liverpool's business rates, 270 million that goes back into adult social care, goes back into education, comes from that sector. So as a city, it was more important than perhaps for many others to get that sector up and running and get it up and running safely. So way back in November, when we were kind of doing the mass testing and operationally delivering that, we started having a conversation with government about trialling, opening up that sector and trialling and doing it safely. And Ian and partners in the university were hugely supportive of that. That kind of conversation was going on with the Department of Health, and then a parallel conversation was happening with the DCMS, which is a department that is responsible for my world, if you like. And at one point, and Robin will kind of go into the detail of this because Robin did actually do all the work, those conversations kind of clashed together and came together, and we came up with the Events Research Programme. Now, at that point in time, there were lots of other places, lots of other projects that were on the table in terms of testing how you open things that had never had the opportunity to open safely. But what you've got with Liverpool is a collegiate group of people who'd had practice working together before over mass testing. You had a brilliant events team that are really amazing operationally and can make things happen quickly, properly and safely. But you also had the will, I think, from the people of Liverpool who know how important culture and our story is to them to make this happen. So government got that really quickly, and they put a guy called Martin Henderson in charge of the whole process, who I'd worked with before, and who really drove the whole project from inside government. It's a really odd thing because the events that we did, so the three events that probably we're talking about today was the nightclub, which was Circus nightclub. It was festival, which was the festival in Sefton Park. It was a business festival in the arena, and there were a couple of others that kind of came and went for various reasons that Robin will go into. But those events in themselves, as for a city like Liverpool, are actually really easy. You know, we do them all the time. You'll have seen that happen since we've opened up. They're not difficult. But when you kind of put together the very, very odd bedfellows of the City Council, commercial operators who were literally putting their livelihoods on the line to do this, the universities, central government, all the various different boards that Ian and others will talk about, and my very own Director of Public Health, who normally we would have just had a conversation with about, you know, what we're selling on site. That is quite makes it hugely more interesting for us, but also hugely more complicated to deliver something. Just hats off to the operators who we work with, who were amazing, and there was just, in terms of the trajectory of it, I don't think any of us realised the amount of profile that it would have. So just after it was Easter weekend when the conversation around lateral flow testing got mixed up with vaccination passports, and I think that's the first time for all of us that we thought, gosh, this is hugely impactful, it's properly international, but it was a bump in the road that probably we didn't need. But I think what was really incredible about it was the way that we all came together with the same voice. And from that, I think kind of key learning points for us was to create a communications group with all the commercial providers, with central government, with local government, with public health, with the universities, so that we were very, very tight as a community of a city in how we kind of did those events going forward. It then, obviously, the events happened. Again, other people here are much more kind of qualified to go into the detail than I am. But I think what was really incredible for me from a very personal level was the amount of open-heartedness the people of the city walked into them with. You know, we had no issue whatsoever selling tickets for Circus. We could have sold festival probably 4 or 5 times over. The business festival was slightly trickier, but it was an older age group. It was an older age group who were probably slightly more cautious, and that was kind of a harder sell. But the music events were amazing, and to walk into a site which is full of young people who've been locked up for 18 months, I think we did more than kind of test a research program. I think we, at a very, very dark time in this city's life, gave back kind of hope and a light at the end of the tunnel, which, although we've measured the success of the events research program and the detail from an academic point of view, those kind of emotions and the way that the city was portrayed over that weekend and the lift it felt like it gave the whole city, I don't think can be underestimated. And I think that kind of whole way that we all came together with that had an incredible outcome, an incredible kind of intellectual and academic outcome that went around the world. But for the city to be on the front page of the New York Times, with Scouse voices on every radio station, on every television station, across the country and actually across the world, was just amazing. So the work that people on this around this room put in, day, night, you know, it was one of the hardest things I've ever been part of. The thing that where we had probably the most to lose. It was a huge risk we took, but with the support of, especially I think of the academic sector and of Matt, there was a real, and it's not the word dignity, but there was a real depth to what we did that meant that it was completely the right direction to go in. Would I do it again? Yes, I think we absolutely would as a city. I kind of miss it now, Ian. I'm looking at you. I'm missing all those late night calls and those, but I think we did a really good thing. And I'll just finish. The Minister for Tourism, Nigel Huddleston, put a tweet out the other week saying that Liverpool, the reason why the events are opening now is because Liverpool took that brave step. And I think everyone on this call, you know, all the directions we went in, all the kind of pain that we went through, everyone on this call should be very proud of the kind of steps that they took to make that happen, because we changed the trajectory for not just for Liverpool businesses and Liverpool people, but for the rest of the country. I'll stop there and pass over to Matt.
Thank you. Thanks, Claire. So building on what Claire said, I think that the context here is really important. So the backdrop of COVID, but the pandemic has affected all of our lives. It's affected us really badly, and no more so than the city region, where, you know, we've had around 15% of the population kind of come down with COVID at one point. That's the measurable data. There's probably a lot more than that. We've had significant illness, and obviously we've had lots of sad deaths as well. So we've got a backdrop of the pandemic affecting all of our lives. We've had lockdowns, we've had hyper-local outbreaks that we've managed, and the good example we've got is Prince's Park, where we had an outbreak which we managed, and we closed down it using our data, our intel, and our networks, our communities, in under 3 weeks, which was a massive success in what is a diverse and vulnerable community. And then we went into the second period of lockdown with a massive spike in Liverpool in September, October this time last year, where we were saying to government, we want to be part of something, we want to be brave, we want to be bold, we want to be proactive, we want to protect our communities, and what can we be part of? And that's where the mass testing pilot came. And as Claire's spoken about, that was a massive partnership effort to get mass testing into our communities, using the power of our data, the power of our intelligence, using the Cypher platform and so on, but also using the power of our communities and the power of our networks. And it was a massively successful intervention that I think evaluated with a reduction of 21% of cases as a result of that. And so this is all kind of building on the experience, the pandemic, the COVID journey that we've had. And it's really important, of course, that we don't just live in a perpetual state of pandemic, but we understand and learn from the data, from our experiences, about what we need to do to live with COVID. And COVID isn't disappearing off anytime soon. So how are we best placed to live with the pandemic, to live with the virus? So that, taking that brave, bold, proactive approach absolutely led us on in the way that Claire's described to the events research pilot. And it's that balance of risk versus normality, or learning to live with the virus in the best way possible. And of course, one of the outcomes was that the learning we were getting out of the pilot could be taken into national policy and strategy. It's a slightly different context from where we are now. So infection levels were low and the Delta variant wasn't around. So it's worth noting that. But the learning that came out of it was absolutely crucial. And I think there's three kind of main bits. One, firstly, partnership working. So as Claire's described, you know, Director of Culture and Director of Public Health are probably not natural bedfellows, but now we are, and the fact that we're kind of like together in a room speaking probably illustrates that. But it's not just culture, it's not just the local authority, it's the university, it's the event promoters who I've never really worked with before, but we were incredibly willing to be part of it. Our university, our fantastic university colleagues who gave us a lot of the support around the data, the intel, and how to kind of get the practicalities over the lines. Robin, who will speak in a minute, was phenomenal, and the communication and engagement with our communities is absolutely essential. And if you don't get that bit right, it won't work at all. So partnership working is absolutely crucial. The second bit is data and intelligence, right at the heart of this. So understanding the patterns of the virus, understanding the intervention that you're putting in place, and understanding the impact of that intervention on what you can mitigate and what the moving parts are. And I think that the communication and engagement with general public is essential as well, because people have to, this is a hearts and minds thing, people have to understand why you're doing, what the value is, where that balance of risk and benefit is, and what the city and the city region gets out of it. So, you know, we had really strong protocols in place, but making those protocols kind of come to life in process isn't easy. As Claire said, it isn't easy. It takes a lot of work, a lot of effort, a lot of late night thinking, a lot of rewriting, and a lot of practicing. And as we went through the ERP process, starting with the Good Business Festival, there's fair to say there was a fair amount of rewriting after the Good Business Festival event to get things ready for the Friday night and the Saturday night Circus events, which then went into the Sunday night Sefton Park event. So you're learning as you go as well. You're learning what works, you're learning what tweaks. And the fact that the promoters were absolutely willing to tweak their processes and change the way they were doing things was incredible. I think I'm going to conclude with a few personal reflections. And you know, we all have kind of big moments in our life, don't we? But working with kind of DJ Yusuf down at Circus on the Friday night, and Ian and myself kind of hitting the dance floor, that's something I will never forget. I didn't go to the Fatboy Slim event on Saturday. I thought that I was probably slightly too old for that. But I went to the Sunday event, the Sefton Park event, where we had three amazing artists. And the middle one of those was the Lathams, who are a band from Wigan, who now, and so it was kind of one of their first big events. They were touring and supporting the Blossoms, who are already a big band. The Lathams album has now gone in last weekend into #1 in the charts, and if that's what you call them, the charts. But they are #1 anyway in the hit list with their album How Beautiful Life Can Be. And I think the lyrics from that song are, let the children have their chance to see just how beautiful life can be. And I think if you reflect on how hard the pandemic has been on so many of us, non least our wonderful children and young people who have not had the chance to experience life in the way that most people normally have, I think that shows the importance of why we've done things like the Events Research Programme and why we capture the learning from ERP, which allows us to deal with COVID despite the fact it's not going anywhere soon. I'm going to hand over to Robin. Thank you very much.
Thanks, Matt. I think it's just worth saying that anyone who was at the Friday Night Circus and saw Ian and Matt dancing also won't ever forget that moment. So I think we're going to talk a lot today about outcomes. I thought I'd just use the time I've got to actually just take us back to where we started with this, which is that every aspect of this project, it should have failed, right? When you really look at the hurdles that were in place, the fact this even happened is an extraordinary feat of everyone's ingenuity, effort, hard work, and the fact that it led to the success it did is kind of extraordinary. So to just kind of put it into context, you know, our world as kind of live event professionals and creatives, what you want is a long lead time. You want to make things as easy as possible for your audience to gain access to what you're trying to achieve. You want to try and reduce the numbers of people involved in something, moving parts, to make it as simple as possible so you've got total control. And they're the kind of outsets you begin with. And actually from conception, this project was the exact opposite of those things. So the way that this worked is we were given a set of criteria from the science board that said we would like you to explore the following settings: a nightclub, a business event, conference, outdoor, for us to explore those settings and for us to be able to track those things scientifically. So what we were able to then do is go away, speak to our colleagues, the promoters that we work with, contacts. And what was kind of extraordinary in the first instance was we were approaching those people and saying, basically, can we do a major piece of public sort of scientific research using your money? Let's be really honest about this. These were not publicly funded events. These were run by the private sector, and pretty much everyone we spoke to said yes. So we got this incredible immediate kind of sort of support behind the concept, which was great. Turning that then as a kind of having that kind of group together into then what everyone saw when they went to those events. There were processes that we went through that you would just never normally look at, and sort of been alluded to already by Claire and Matt. But when you've got, you know, scientists, promoters, gig goers, central government, those things in themselves kind of have competing challenges. And then even within the government, where we had a group which has got DCMS, which has got DHSC, which has got BEIS, the Home Office, there's a huge number of voices, opinions, and no one had done this before. Let's not forget this. No one had done it. What we know now, we designed and developed through that process. So none of us really knew how this was going to play out. And so the amount of consultation, discussion, development that we did was absolutely, I mean, I cannot speak highly enough of colleagues, I would say, within DCMS, who were fantastic at supporting us in enabling these big conversations to take place, and at the right moments being able to kind of bully things through the processes within government to help us make this thing happen. Because we turned something around that normally you'd give yourself kind of 3 to 4 month planning cycle into 3 to 4 weeks. So we've got everything, all those moving parts moving at a huge rate of knots. The critical thing that I guess I wanted to kind of land on is that we made this incredibly hard for the audience. So the key thing you're always trying to do with an event is reduce the barriers to entry. Let's make it as simple as we can. And actually, by virtue of this being what it was, we made a huge number of barriers for that audience for engagement. So for a start, you had to be based in the Liverpool City Region, so we could kind of access your content through the Cypher network, and also to reduce that kind of movement nationally for the demand we knew we were going to create. You had to be over 18. You had to undergo this testing regime that we were putting into place. You had to put yourself bluntly in harm's way. We didn't know how things were going to quite work through, what they were going to look like, how they were going to operate and feel. And you had to pay for it as well, right? This wasn't a free ticket. These are things that are commercial kind of deal. So the level of barriers to entry we're putting into place, I think in themselves, again, made us all quite nervous in terms of how we're going to, because it felt so counterintuitive to what we're trying to achieve, what we'd normally do. So once we got those things in place, those processes and protocols set aside, and Gary will talk at length post me in terms of what we did and how we did it, kind of really extraordinary work that kind of went on behind the scenes around that. I think then the key thing is around how this stuff then lands. So Claire alluded to it already, but when we announced this, it's always good to remember these things. When on Easter weekend, this project was leaked and was announced to the press, it was put in the context of what we all know now as a COVID passport. So back then was something that didn't really exist, and the backlash was extreme. So from the outset, within 2 days of announcement, one of our partners in this, Hot Water Comedy Club, had actually chosen to step back from delivering the event. So they were on board, they were going to run our first pilot event with us. They came under so much pressure from anti-vaxxers, people who didn't agree with what we were doing, bluntly taken out of context because of how that was presented to them. They felt it was untenable for them to continue, and quite rightly in their view, dropped out. The level of kind of ripple effect that created is hard to underestimate, because in many, many ways, at that point in time, the entire project could have rolled, it could have folded. I think it's absolute testament to the belief and the will of people on this group that we were doing something that was worthwhile, that was for the greater good, and also that was much, much bigger than these things that were being discussed at that time in the press, that we had to kind of continue to go. And absolute hats off to the guys at Live Nation, Circus, the Good Business Festival, also Luna, to actually kind of back, we had some really tough crisis calls with those people, and I would not have blamed them in the slightest if they'd chosen at the same time to step back as well. They didn't. They put themselves in harm's way, as it were, and continued to go forward. And actually that did, Claire mentioned it, it was a turning point, because at that point, it clarified for us all, I think, right, why we're doing this, why it's important. And I think the ability that we were then able to know that was so hard what we went through, surely everything else is going to be comparatively okay, meant that we achieved a huge amount in not a lot of time, really, testament to the skills of the individuals we were looking at and working with. I'm going to wrap up quickly and hand over to Gary, but just a couple of things that we weren't expecting to be really big issues for us, but were really interesting and now come to fruition more so now is access to talent. You know, people that we would usually easily pick up the phone to and say, can you bring us a stage? The entire market for casuals had gone because people had moved into other jobs, they were on furlough, they were elsewhere. Actually, our ability to actually stage the events became incredibly challenging for us to be able to access those pieces of talent and the right people. The protocols that we were going through in terms of the accesses, the amount of conversations with legal, were we able to do this? Were we not able to do this? What was the processes? Incredibly complicated. And then my tee up for Gary is ticketing. So again, huge kind of sort of shout out and thanks to the team at Ticket Court and ACC Liverpool who kind of led the marketing and ticketing process here, because what they became, which you were not expecting, was a ticketing agent became the face of these events to the audience. And the sheer amount of direct communication we ended up doing with the audience was phenomenal. About 30 individual pieces of contact for each ticket holder, whether it be text message, email, direct comms, across each of these things. And what it created was this incredible flow of information that was going between us, the organisers, the promoters, the audience, which in itself was incredibly valuable for us to be able to take that content in, understand what people were concerned about, feed that back into the research and the way they were designing plans, but also has shaped how going forward, lots of our post-COVID world, how we are running and operating events in order to enable people to understand what they're entering into and the kind of process they're going through. So we'll touch on lots of this stuff later on, I'm sure, but as a kind of digital baton pass, it feels right to hand over to Gary to talk about how we deal with this stuff and the dark arts of data collection.
Thanks, Robin. Yeah, so I mean, as has been mentioned, the reason and the benefits of doing this in Liverpool was that we had this tremendous existing data infrastructure we could use as the spine for the data we wanted to collect, that we already had that community-driven approach across all these different services, linked across public health, the NHS, academia, while also being able to sort of bring in colleagues from not just from the City Council in terms of the events teams there, but organisations like Ticket Quarter would be instrumental in building parts of this infrastructure as well. And so that helped us then to basically sort of sit down and start to think about, well, what would this look like? How do we build this, what we call intelligence-led system, while sort of maintaining that local oversight, to really guarantee that this was safe, that it was secure, and that patient confidentiality, people's confidentiality in this was also respected. These were important issues, and we're clearly very much a part of those discussions, as we've heard over that Easter weekend. So in the context of all these sort of governance and technical challenges, you know, we had some basics that we knew. We knew that we were building a solution really for research. We weren't building something that was how we would expect the world to be as we return to normal. So we knew that we had to meet certain obligations. And so there was something sort of slightly different there. But we also wanted to make it as normal as possible. As Robin says, the inclination and the request from him was always, you know, how do we make it as easy as possible for people to attend? How do we make it so that we're basically reducing that friction? While at the same time, you know, we needed to introduce a certain amount of challenge for people to get through, because they needed to fill in forms, they needed to do the testing, they needed to do give us permission to do those things, and we needed to be assured that people understood the risks and how we were using their data and the different challenges that were there. So for privacy and technical reasons, we didn't really want to collect NHS numbers from individuals. People often don't know what their NHS number is anyway, but also there were sort of other constraints. The ticket system, we didn't want to have a ticket system that was holding medical data. We didn't want to have a ticket system that was holding research data. That's not what it was for, and it felt very inappropriate to do so. So we needed to think about how then that would work. How would we link ticketing to both the research data that Michael was collecting, which he'll touch on in his part, and also with the NHS and the Cypher system. So to do this, what we needed to make sure was that the researchers didn't know who was participating, that the ticket seller wouldn't know any of this sensitive medical information, and that the share cared system, Cypher, would be able to actually link to the test results for people who were attending the events, so that we could guarantee that people had the test when they were attending the event, and that the event therefore was as safe as possible, and helping Matt's team and the public health team to both understand that and also be able to respond to anything that did happen. And all of this also then needed to be validated through our governance. We had, the CIFA has protections built into it to prevent it from being misused, such as the Data Assets and Access Group that has GP membership, that has public membership, and they were also a critical step in ensuring the work sort of met our obligations there. So overall, the infrastructure, the way that, just very briefly, the way that the process worked was that somebody would go to TQ, they would see an events page that would look like a normal events page, but at the bottom would be an indication that of what was being done differently here in terms of the research process. That would take them then to a questionnaire which would generate a study-specific identifier for that individual, which would then sort of carry through the rest of the system by being passed back into the ticket system when the person purchased the ticket. We were then able to use that study identifier to be able to match that then into CIFA, so that we could look to see on the day whether people had their tests or not, and to guarantee therefore that when somebody turned up at the door and they were showing their evidence that they'd had a test, we could be assured that those were sort of real. One of the challenges with sort of text message and SMS type messages around the testing is that, you know, they can be falsifiable. They also don't necessarily include information about the type of test that was done or where it was done. So by having this whole system underpinning everything, we could offer that level of assurance to Matt, so that he could feel safe in allowing these events to go ahead. And so, you know, on the day of the events, we were able to match over 95–96% of the test to tickets, so that we were able to recognise that, you know, those that people had met those conditions that were attending the events, which was absolutely fantastic. It was a little bit nerve-wracking on the morning. Just because you know, this has been done in such a hurry, we hadn't been able to do full end-to-end testing of all of this, so it was fantastic work from Ticket Quarter and also the company GraphNet that supports us on the CIFA program to be able to deliver on all of this. I know they put in a tremendously large amount of work and long hours in enabling this system. But it's also, you know, which was great for us and great for what we're able to do. But we do need to recognise it probably isn't, or wasn't at the time, replicable nationally. We couldn't, this couldn't be used for the other events. The level of detail and quality of information that we had was much richer than was available in other areas. And in fact, one of the outcomes from that has led to us working to actually expand the CIFA program, working with other areas that are using similar systems to be able to allow them to enrich their own data sets, so that we have the same level of capability going forwards across, not just in Liverpool, but across large parts of England as well. We also needed to fit in nationally with information governance challenges, with the wider strategy and the program as well. So colleagues in the Department of Digital Media, Sports and Culture, Culture and Sports, were invaluable in helping to coordinate this work and pull together key parts of documentation for us, and make sure that those messages and that consent model that we developed also then could be used to support those other events, so that they was actually, you know, a part of the ticketing process across all of the national events was based on the work that we'd done. And so, you know, which was important not just for Liverpool, but it was important nationally too, because people needed to understand that they were participating in a research program, not just going to a concert or to a snooker game or a football match. That you know, that this had that wider sort of challenges and risks associated with it, and also the benefits as well in terms of learning that we were hoping to do to use as part of our reopening going forwards. With that, it's probably, I think, covers most of the sort of the technical side of things. I'll just pass over to Michael to talk a little bit about how then he was able to use the data that we collected.
Thank you, Gail. Well, our task on an independent level was to carry out independent surveys and questionnaires. And this was across all events in Liverpool, both before and after. So we collected responses from almost 50,000 people who either wanted to attend, were interested in attending, and were able to give us a reflection. And the reality has been said before, this was reflective of social events, and this was seen in the people attending. I think over 50% of those attended were going as groups of 5 or more people. So after months of lockdown, individuals were clearly excited about reuniting with friends and loved ones. And Liverpool was in a unique position to allow that and put this into a program that can be done. Attendees raised various concerns, and all of these had to do with either uncertainty about testing arrangements or accuracy, hygiene regimes, increasing reports of new variants, if you think back to April, and overall the fear of infecting others following the event. And all of these were reflective of concerns that the organizers were attending to, as well as people wanting to go. So again, it was a reflection of this is a shared acute awareness of the risk that the program brought with it, but also the importance of carrying out such an ambitious action research program. Again, this was very applied, and it was a unique position. We can very happily say today, as Robin said before, over the various barriers, that it was highly successful. People were extremely satisfied. People were praising the organization, the access arrangements, and overall the enthusiasm that everyone put into that program. Individuals were even highlighting almost a feeling of normalcy returning to these events despite the logistical challenges. And as Robin said, despite the number of barriers that we put in, barriers in terms of protections, people still wanted to attend. And this was further reflected in the confidence that people shared afterwards about these events and what they thought of events going back in the future. If we think back a few months ago, a lot of the activity that we do today didn't seem feasible, but as Robin said, we are living with this and we're learning to live with this. Over 80% after having attended said we were ready to do all of this again. The barriers, the testing, all of these steps were done in a way that was respectful, that was done in an open manner. And again, with that window, this wasn't an open endorsement of Passport, but people recognized and accepted the procedures that were put in place, importantly to keep themselves safe, but others as well. So it was a comprehensive review of why this is being done and why this is important. And giving huge credit, this was only possible in large part down to the open and transparent communication that was led across the board from the council, from the local authorities, from the commercial partners. This approach reinforced narratives around civic duty, the ability for Liverpool and the region to do the right thing at the right time, always in mind with being there to protect family and friends. And again, this was further confirmed. We have a separate team who was looking at social media around that time. The same sentiment was present there with an overall positive outlook. So I think the key thing that we found through learning as we did it was reinforcing the importance of public trust and engagement that is required to deliver such an event, to have open and frank negotiations with those attending. As Gary and Robin said, we put a lot of steps in place with a lot of teams working very hard, but throughout it was clear why those steps were there, why this is being done for them. And the other thing is, this is something that needs to be built over time. We found this from the participants. And here again, Liverpool was in an amazing position where the seed for this was planted during the smart testing rollout. The only reason why Liverpool was able to be identified and run something like this is because they had done a good job since November last year around the smart testing. So the direct communication, which are directly addressed public beliefs and their concern, was paramount to build trust and mitigate risk. So again, I know we've said it as a team, but it was only through this comprehensive effort for collaboration that we were able to host these events. It wasn't always easy, And I think everyone can admit we weren't always 100% sure how it's going to turn out, but we're extremely confident of what we did, why we did it, and that's what we can say today that was the right thing to do. But I'd like to hand over now to talk about some of the other experiences and hand over to Rhiannon.
You're on mute, Rhiannon.
Sorry, easy to forget that. What I'm going to do for my 5 minutes here is to present some of the research findings that we gathered within a series of 8 focus groups. And that's so that we can get a more nuanced understanding of attendees' motivations, their behaviours, and also their attitudes and feelings about the reopening of events and their attendance at them. So people have talked, for example, about the very positive way that people responded to them. I want to have a look at some of the data that reflects that. But before going on, I want to just acknowledge the very hard work of the postdoc researchers and the administrators who worked on this aspect of the events research programme with me. So Nyla Khan, Deborah Fisher and Daniel Lawrence, grateful thanks to them for all their help. So what we did was we contacted a semi-random sample of about 360 people who'd attended one of the events, and we sent them an invitation to attend the focus groups that we were arranging. And we were eventually able to hear from 31 people, 21 women and 10 men, ranging in age from 18 to 71, and some older people did go to Circus and did indeed go to Sefton Park as well. And we were keen to gather these recollections of things quite close to the event themselves. So all of these focus groups were held within one month of the events. And the focus group schedule, so the kind of things we discussed, in other words, was wide ranging, and it covered issues like why people chose to go, what they did when they were there in terms of abiding by COVID safety measures, their attitudes about Liverpool's involvement, the brave step that was being taken in the early reopening of events. And just to say here and now that this was wholly positive as far as the attendees were concerned. And also about the future nationwide reopening of plans. And finally, just to gauge a really vital feeling of what their feelings about being at the events was. So the analysis that we've conducted has indicated 3 broad themes coming out of the events focus groups. And these are safety and feelings of safety, enablement and how this was made possible, and importantly, in picking up on the theme that Ian talked about early on, the return of social well-being as a critical aspect of what it means to live in cities and in societies. And rather than talk through these themes, I'm going to let the data speak. So I'm going to just read out some quotes from the focus group participants, and they really help to provide a snapshot of our findings. So starting with feeling safe, people generally did indeed feel safe at the events because of the strict precautions built into the process of attending. There was some, niggles about the process itself here and there. And as well as feeling safe, there were also very clearly some vestigial niggling worries. So for example, one person who attended the business festival said, I was quite anxious before going to the event that I would find it very uncomfortable to be in an environment with so many people. It's gone from nothing at all, if you like, in the space of half an hour, but amazingly, I felt completely safe. Another attendee at the business festival, I felt very safe knowing that everyone had tested negative. I felt very safe. I did think originally that I might keep my mask on, but then when I got in there, I thought, no, take the mask off. I don't feel that I need this. And then an attendee at Sefton Park, it was kind of like the whole pandemic really hadn't happened. I think a lot of people kind of forgot about it for that night. And that made me feel, to be honest, completely safe. I didn't really think about any aspects of danger or anything, because obviously everyone had had the test. And then somebody from Circus, because I know that we had to have the test beforehand, and the fact that we had to show our results on the gates, it gave me a lot of confidence that it would be okay in terms of coronavirus. But there was still a little bit of a thing in the back of my mind, knowing that there was still a risk where I could contract the virus and potentially spread it. But apart from that little thing in the back of my mind, it was okay. So on the return of social well-being, wanting to attend these events was really strongly related to a longing for community with like-minded people. And that was very palpable as we spoke to people. There was also a sense of wanting to hasten the more general nationwide reopening of activities and events to restore that hedonic well-being that we need so much if we are to feel good and to function well. So somebody from the Business Festival focus group said, what I found was as you went up the escalator, you were just made aware of an atmosphere that was fabulous, chatter. And when you looked around, you just saw some beaming smiles, which we haven't seen for so long. That was just, oh, we're back in the room. And it was just so lovely. One of the attendees at Circus said, it was nice to be back in an environment where people could just let go and not have to worry about social distancing. And I think it was really good for my mental health personally, because I used to always go to these events, as I said before. And one of the main reasons why I like these types of events is a release from stress, where you can just dance and enjoy it with other people, and being back in that environment again, it was really nice. And somebody from the Sefton Park event, it felt natural again, yeah. And I think it just felt like it was getting back to normal. It felt really good in terms of going back just as a singular entity, stuff opening and going back to stuff. I can't wait. I've got stuff booked in right through to the middle of next year. So as long as I get to Glastonbury next year, I'll be happy. Another attendee at the Sefton Park event, it was really easy to forget that there was actually a pandemic going on at that moment. Being at uni and having that social aspect to life sort of taken away, it was nice to have that again and to be around just a mix of people and be able to speak to anyone. And finally, and picking up on both Ian's and Matt's reference to lifelong memories, for me, the most powerful aspect of the data was the strong sense of the creation of these lifelong memories associated with that overwhelming power of positive feeling that was experienced at the event. So here's some quotes relating to that. So somebody from Circus, I think there was a huge amount of positivity and almost to the point of euphoria. Everyone was so happy and energetic, and you can just see smiles on everyone's faces and dancing away, and everyone was really going at it. And yeah, it was really, really great. I absolutely loved it. And yeah, the time absolutely flew by. It was amazing. And somebody from the Business Festival, after about 5 minutes, I was getting hugs from people, and we were just standing all close together. And definitely as the day wore on, the contact came closer and closer, and then now the noise got louder and louder. So it was really heartwarming for me. And perhaps the most powerful quote, which I'll leave you with, somebody from Sefton Park. I cried on several occasions with the friend that I was with, and saw many other people crying with emotion. I'm getting quite emotional actually just thinking about it now. It was overwhelming, really. Yes, amazing, amazing. Up there with the most memorable nights of my life, I would say. And really, I think because of, it was a great concert and the bands were great, but it was so much more than that. It was such a momentous event. Yes, I can't quite express how amazing it was. And with that, I'll pass you over to Gervin, who's going to talk about a very different kind of data.
Thanks, Rhiannon.